Hi, everyone, and welcome back to another episode of the Business of Boutique Fitness. I'm your host today, Rachel, and I am a coach and consultant with Studio Grow. I came from fitness franchising, and I've owned my own wellness business that supports women for the last 20 years. And I'm really excited to talk about this topic today. If you have ever had a client ask, or maybe you've wondered, can I have my insurance pay for my membership? Can I have a partnership with my physical therapist and my studio? The answer is yes. We're going to talk and cover some of that today. That has been a game changer for my small business, is really pulling in healthcare professionals when and where needed, and also getting some funding, or at the very least partial funding, for my products and services that I offer. So let's level set for a minute and talk about why. It felt intimidating to me to start because the world of insurance feels big and scary and confusing to me. So I really had to kind of dig in, create some local partnerships to kind of kick off the process. So I first started with a physical therapist who helped me start unpacking some of the complexities of what potential partnerships might look like. So, some data points that I want to make sure that we cover. We know that 1 in 4 Americans have a chronic illness, and many of that population have 2 or more chronic illnesses. We also know that our obesity rate in the United States is nearing 50%. Children are closer to 40%. And so we have a lot of people feeling unwell. So, how can we reach more people? How can we help serve them and get some of these products paid for and services paid for as well? So let's start with looking at some of the benefits. So I have a studio, a client. She is in Colorado. It is the most wild thing to me when we met because she has never done any ads on Meta or Google, which is kind of some of our major recommendations when you're marketing and trying to generate leads, because she owns a great yoga and Pilates studio. And before she even opened, she went around and she partnered with physicians and physical therapists. So the majority of her clients are referrals from these healthcare professionals, and or just word of mouth from her clients. So it blew my mind that up until we met, because I was like, well, why don't we put out some ads and bring in even more people? But up until we met, she had just run off of healthcare professional referrals. So bringing in more leads, and think about this, more qualified leads. So this is a doctor essentially saying, hey, as your next step or as part of your wellness plan, I want you to make sure that you are doing regular work on a reformer, that for mental health reasons, you're integrating breath work. So really thinking about, like, how can we get in with these healthcare professionals and help educate them on what a partnership would look like if we are doing patient-centric work. And again, it also expands some new revenue channels as well. So I wanted to start with looking at a physical therapist partnership. This is, and again, and anyone who's listening to, you don't need a referral or a prescription to make a physical therapist appointment. So usually, if you have insurance, at least a set number of visits per month or overall in your lifetime with that provider, you'll have access to a physical therapist. So keep that in mind. But I would talk about this as post-rehab, whether it is injury, surgery. I have a lot of physical therapists working with youth athletes that are referring out football teams to go get their cores really strong on a reformer and work through some of those injury prevention methodologies, because we know that youth sports has a lot of injuries and it helps them stay strong and mobile. Another one is working with primary care physicians. So I I find this is the most challenging group to connect with, mostly because of limited staffing capacity. They don't have a lot of time to sit down and talk about strategy with a studio owner. So, putting together something that is more of a formal proposal, talking about your value proposition, what you do, why you do it, how you do it, and how it would benefit their patients to refer them out to you as part of, again, this more holistic wellness plan would be something really helpful. I always include on that proposal, because sometimes you can't get in front of the provider, working with a PA, with their nursing team, adding a QR code, and just a lot of it is finding the right person who makes the decisions would kind of be your biggest blocker there. But I would say that should be a more formal presentation. Show up essentially ready to sell a physician on why what you do matters and how it best supports their patients. Chiropractors, holistic medicine, integrative medicine, kind of the people, I mean, personally, I don't put them kind of like on the, outskirts of medicine. I think it's very much a valid route for treatment, but kind of think about what we might call those alternative medicine people, massage, acupuncture, like how can we reach some of those groups and partner with them, whether it is something where you do a client-based share or you do a pop-up event. I love having a chair massage person come to an open house, or at least being able to refer people out where it both parties like benefit from it. Actually, all three of them, because we got to put our client in the center there too. So really think about how can we partner, leverage them for services, refer them out as needed. And then I think a space that gets overlooked a lot is mental health providers. So we know that movement is medicine. We absolutely have the science and data to show that a lot of healing really only begins with movement. It can only kind of start moving from the body. So really talking about and getting with them as thinking about trauma response yoga, trauma based weightlifting, and really talking about like different strategies that you can use to help people heal and continue their journey with mental health. As a certified trainer for 20 years, I really don't think there's just one thing that is the cure for people. It really requires a body, mind, soul treatment. So the more that we can get people connected with those services, the better. So let's look at kind of different plans that you can offer, right? We have to be careful in the world of fitness not to use the word prescription, but like between us, this really is kind of a movement prescription. Or if we put our clients in the center and we look around, like what can we surround them with? What teams of people, what types of services do they need to feel their best? So looking at post-rehab fitness plans, really working with their physical therapist. For my business, I have a physical therapist that I'll partner with to help me do movement assessments, or if there's pain we can't explain, let's talk to a PT. So really, it's a collaboration, right? So we're sharing feedback and input from each other on our clients. Looking at those chronic illnesses that we know are running rampant in our population. So diabetes, arthritis, anything, high cholesterol, glucose levels, anything that can be improved with movement. I always think let's do movement, nutrition, recovery, all that side of things paired with your medical plan. I don't think there has to be you have to choose. I think both can exist and it can actually really help propel the patient and client forward. Community initiatives. I know this is maybe kind of a low effort, potentially even low return. But really, this is we want community walks, a free events once in a while, making sure that we're servicing the community in a way that feels good, that allows them to come participate, show up. It's not a huge lift for you either, but even just my clients, I call them hot girl walks or taking an awe walk, which pro tip, if you want to try it, you take a walk, whether it is 2 minutes long, 2 hours long, and you just really kind of sit and relish in all the things you can spot that potentially bring you joy. So these are little things that you can assign to your clients when they're not with you that helps them get embodied in health and wellness. That doesn't cost you anything other than a quick message, a quick reminder at the end of class, and really helps with retention and gets them thinking about wellness when they're not with you. Okay, so how do we get started with this? Looking at education. So let's see, how can I put this? All right, doctors aren't fitness experts. They're not. They've told me this, just so you know. They've told me this. So we are going to need to bring them data, case studies, heavy on the education side to let them know how this all works. They don't, I have a couple physician friends who said they got like a chapter on nutrition in all of their schooling. So we can lean on each other and learn things from each other and help educate them into making the best decision possible for their patients. I love hosting workshops or even pop-up classes or demos just for the people that you're trying to partner with. So invite them to come experience what you do. I think that is actually teaches them more than just a wordy presentation, is have them come into the studio, see the culture, see the movement, experience it all so they can really like understand and have an immersive look into what happens inside your facility. And then really looking at how do we, benefit from this. So think about referral programs, revenue shares, joint programming is always great. Like I said, I'll pull in movements that I know the PT wants the client to do into our workouts as well. So a couple of resources, because this is actually such a really interesting space, and I feel like we're right on the edge on passing some different legislation and starting to look at how insurance can lean in and fund some of these programs. There is a program, and there's similar spots like this, but I always tell people, for example, TrueMed is a service provided that you apply, you get approved, and then your clients go in, fill out a quick questionnaire, and TrueMed essentially helps determine whether movement or whatever your services you offer can be considered necessary and used as a prescription. So if you're approved and they're approved, which I have never had anyone not approved, which is a great start, but it refunds them up to 30% of their services. And they can even choose if they want that reimbursed every month or every year. So honestly, that was a huge game changer for me because it allowed me to increase my prices to a place that I needed them to be, but also still made it accessible for my clients. So there are programs out there like that. Remember too, different health insurances have different benefits for their customers. So for example, through my insurance, if I go right into the app and I set up my profile and all the benefits that I want to receive. So last month, between, I believe it was my daily steps, my workouts, and logging my weight, I earned something like $60. And then I can choose. I can have that put towards my monthly insurance payment, or I can do it as a gift card, which I did, and then bought more spin classes with it. So there's different ways. So really encourage people to like look into what their insurance offers. A lot of them do offer incentives for them to get healthy and move. And then there are programs out there like TrueMed that are working to reimburse people as movement as as a necessary part of their prescription plan. There's one other, now this is more of a legislative piece that I want to make sure I explain correctly, but it's been over, so you might have heard about it in 2020, but it's actually been around an act that a group has been trying to pass for close to 10 years. The National Academy of Sports Medicine, NASM, is a big driver of this change, but it's called the FIT Act. And essentially, it's a legislation that's trying to be passed where the TrueMed that I just mentioned, where they cover a percentage, they want to open up to the entire population funding for things like gym memberships, acupuncture. So anything that's considered wellness would be essentially paid for, or you can use your HSA and FSA dollars, which I also forgot to mention already. That's another really big one, as I encourage people, if they have those, put their dollars towards their memberships. It's so it's super easy, and you have funds and you're putting money in there anyway. So keep an eye on that legislation. I've heard that if it's going to pass, it will be soon. It will be in the next couple of years. Otherwise, it might get shelved for a while. So I've been watching that carefully. I know it bubbled up in 2020 because a lot of facilities were closed. They didn't think they should have been. And so that act tried to kind of really like push people forward to say like, hey, we're on the edge of preventative medicine here. We're trying to make people well. And so we want to be included in and considered when it comes to people's wellness plans. We want them to have the option to have some of this funded for or fully funded for. Okay, so, oh my gosh, I feel like I rapid fired so much information at you. But I do want you to think about the importance and the benefits of partnering with healthcare professionals, whether it is a physician, a PT, a chiro. And on the other side of that, how can we help people find funding if money is a blocker, whether it's through their own insurance companies or applying for things like movement prescriptions, and then possibly even the future of legislation changing where nationwide we have more access and it's more financially available to us. So if you are watching us on any of our socials or our YouTube channel, please be sure to like, subscribe, and share. This is an emerging topic. It changes a lot, but I think there's so much potential if we kind of dig in our heels, get really curious, and encourage people to explore different types of funding and partnerships with their healthcare professionals can benefit all of us.